Who is considered the father of psychiatry? Option A. Sigmund Freud. Option B. Emil Kraepelin. Option C. Carl Jung. Option D. Jean Charcot. The correct answer is option B. Emil Kraepelin classified mental disorders and is regarded as the father of modern psychiatry. Emil Kraepelin considered the father of the psychiatry. The first psychiatric nursing textbook was written by option A. Hildegard Pepler. Option B. Harriet Bailey. Option C. Florence Nightingale. Option D. Anna Freud. The correct answer is Harriet Bailey wrote the first psychiatric nursing textbook in 1920. The first psychiatric nursing textbook was written by Harriet Bailey. The concept of therapeutic use of self was emphasized by option A. Jean Watson. Option B. Dorothea Vaughan. Option C. Hildegard Pepler. Option D. Virginia Henderson. The correct answer is option C. Pepler is known as the mother of psychiatric nursing, emphasizing nurse-patient relationship. Which of the following is a thought disorder? Option A. Delusion. Option B. Loose associations. Option C. Hallucination. Option D. Obsession. The correct answer is option B. Loose associations are a disturbance in thought process common in schizophrenia. Casthasia is a option A. Tremors of hands. Option B. Motor restlessness. Option C. Muscle rigidity. Option D. Involuntary eye movements. Casthasia, intense restlessness due to antipsychotic drugs. Casthasia is known as motor restlessness. The common psychiatric emergency is option A. Aggression. Option B. Hysteria. Option C. Suicide attempt. Option D. Hallucination. The correct answer is option C. Suicide attempt. Suicide risk is the most frequent psychiatric emergency. The most psychiatric emergency is suicide attempt. The concept of unconscious mind was proposed by option A. Freud. Option B. Rogers. Option C. Adler. Option D. Jung. The correct answer is option A. Freud. Sigmund Freud described conscious, subconscious, and unconscious level. The concept of unconscious mind was proposed by Sigmund Freud. Describes conscious, subconscious, and unconscious mind. What salad is a feature of? Option A. Dementia. Option B. Mania. Option C. Schizophrenia. Option D. Depression. The correct answer is option C. Random, meaningless combination of words is seen in schizophrenia. What salad is a feature of schizophrenia? What salad is a feature of schizophrenia? Which of the following is a somatoform disorder? Option A. Hypochondriasis. Option B. Schizophrenia. Option C. Panic disorder. Option D. Mania. The correct answer is option A. Hypochondriasis. Hypochondriasis involves fear of illness without actual disease. Example of somatoform disorder is option A. Hypochondriasis. Hypochondriasis involves fear of illness without. The first antipsychotic drug discovered was option A. Clozapine. Option B. Clopramazine. Option C. Haloperidol. Option D. Risperidone. The correct answer is option B. Clopramazine was first introduced in 1950s. The first antipsychotic drug discovered was option B. Clopramazine. Clopramazine was first introduced in 1950s. Which of the following is a behavioral therapy technique? Option A. Systematic desensitization. Option B. Flooding. Option C. Free association. Option D. Psychoanalysis. The correct answer is option B. Flooding. Flooding is exposed to fear stimuli at maximum intensity. Flooding is a behavioral therapy technique that exposes to fear stimuli. Secondary gain means option A, relief from symptoms, option B, benefits from illness, attention, sympathy, option C, patient recovery, option D, self-motivation. The correct answer is option B, benefits from illness. Secondary gain refers to indirect advantages of being well. Secondary gain means benefits from illness. A child sucking thumb under stress demonstrates option A, projection, option B, repression, option C, regression, option D, denial. The correct answer is option C, regression. Regression returns to earlier behavior pattern. The child sucking thumb under stress demonstrates regression. Restlessness, sweating, palpitation before an exam indicates option A, delusion, option B, hallucination, option C, anxiety, option D, mania. The correct answer is option C, anxiety. These are physiological symptoms of anxiety. Restlessness, sweating, palpitations before an exam. These are physiological symptoms of anxiety. Psychoanalysis focus on option A, unconscious conflicts and childhood experience, option B, changing faulty behavior, option C, cognitive distortions, option D, environmental triggers. The correct answer is option A, unconscious conflicts and childhood experiences. Psychoanalysis deals with unconscious motives and childhood issues. Neurotransmitter deficiency in Parkinson's disease. Option A, serotonin, option B, dopamine, option C, acetylcholine, option D, GABA. The correct answer is option B, dopamine. Dopamine depletion causes Parkinson's disease. Neurotransmitter deficiency in Parkinson's disease is dopamine. Confabulation is seen in option A, schizophrenia, option B, Korsakoff syndrome, option D, dementia, option D, delirium. The correct answer is option B, Korsakoff syndrome. Patient fabricates stories to cover memory gaps called confabulation is seen in Korsakoff syndrome. ECT is contraindicated in option A, severe depression, option B, mania, option C, raised intracranial pressure, option D, schizophrenia. The correct answer is option C, raised intracranial pressure. ECT increases cerebral blood flow, worsening raised intracranial pressure. ECT is contraindicated in raised intracranial pressure. Mutism and posting are features of option A, paranoid schizophrenia, option B, catatonic schizophrenia, option C, disorganized schizophrenia, option D, bipolar disorder. Catatonia involves motor immobility, rigidity, mutism. Mutism and posting are features of catatonic schizophrenia. Most common hallucination is schizophrenia. Option A, visual, option B, auditory, option C, olfactory, option D, tactile. The correct answer is option B. Hearing voices is the most frequent symptom. Most common hallucination in schizophrenia is auditory hallucination. Lack of empathy and disregard for others' rights is seen in option A, borderline personality disorder, option B, histrionic personality disorder, option C, antisocial personality disorder, option D, avoidant personality disorder. The correct answer is option C, antisocial personality disorder. Antisocial personality disorder shows exploitation and manipulation. Belief that neighbors are plotting harm is option A delusion of grandeur, option B delusion of preference, option C persecutory delusion, option D thought broadcasting. The correct answer is option C persecutory delusion. False fixed beliefs of being harmed by others called persecutory delusion. Which drug requires WBC monitoring due to a granulocytosis risk? Option A haloperidol, option B clozapine, option C chlorpromazine, option D risperidone. The correct answer is option B clozapine. Clozapine can cause fatal granulocytosis. The drug requires WBC monitoring is clozapine. Mini mental status examination is used to assess option A hallucination, option B cognition, option C personality, option D anxiety. The correct answer is option B cognition. Mini mental status examination screens for dementia and cognitive impairment. Mini mental state examination is used to assess cognition, screen for dementia and cognitive impairment. Light therapy is useful in option A OCD, obsessive compulsive disorder, option B schizophrenia, option C seasonal affective disorder, option D mania. The correct answer is option C seasonal affective disorder. Bright light relieves seasonal depression. Light therapy is useful in seasonal affective disorder. The first psychiatric nurse in India was option A Florence Nightingale, option B Dorothea Dix, option D Dagmar Brodbeck, option D Hildegard Pepler. The correct answer is option C Dagmar Brodbeck. She started psychiatric nursing training in India in 1943. The first psychiatric nurse in India was Dagmar Brodbeck. Repetition of another person's speech is option A copraxia, option B echolalia, option C perseveration, option D neologism. The correct answer is option B echolalia, imitating spoken words of another person's called echolalia. Labile indifference is seen in option A schizophrenia, option B conversion disorder, option C OCD, option D bipolar disorder. The correct answer is option B conversion disorder. Patient is unconcerned about serious symptoms. Labile indifference is seen in conversion disorder. Patient is unconcerned about serious symptoms. Which drug is contraindicated in glaucoma? Option A selective serotonin reuptake inhibitors, option B tricyclic antidepressants, option C lithium, option D benzodiazepines. The correct answer is option B tricyclic antidepressants. Tricyclic antidepressants increase intraocular pressure. The drug contraindicated in glaucoma: false perception without external stimulus. Option A illusion, option B hallucination, option C delusion, option B obsession. The correct answer is option B hallucination. Hallucinations occur without real stimuli. False perception without external stimulus called hallucination. Priority nursing intervention in mania. The correct option A encourage group therapy, option B maintain patient safety, option C encourage detailed discussion, option D increase stimulation. The correct answer is option B maintain patient safety. Safety is a top priority in mania. Priority nursing intervention in mania: maintain patient safety. Safety is top priority in mania. Antidote for severe lithium toxicity. Option A promazine, option B hemodialysis, option C naloxone, option D activated charcoal. The correct answer is option B, hemodialysis. Dialysis remove lithium effectively. Antidote for severe lithium toxicity is dialysis. Remove lithium effectively. Anterograde amnesia means option A, loss of old memories. Option B, inability to form new memories. Option C, false memories. Option D, temporary confusion. The correct answer is option B, inability to form new memories. Seen in alcohol-related brain damage. Anterograde amnesia. Most common side effect of lithium. Option A, tremors. Option B, hypertension. Option C, weight gain. Option D, hypotension. The correct answer is option A, tremors. Fine tremors are frequent and dose related. Most common side effect of lithium is tremors. Cognitive therapy is aimed at option A, childhood conflicts. Option B, changing faulty thought patterns. Option C, past experiences. Option D, group reinforcement. The correct answer is option B, changing faulty thought patterns. Corrects distorted thinking to improve behavior. Cognitive therapy is aimed at best therapy for phobia. Option A, psychoanalysis. Option B, ECT. Option C, exposure therapy. Option D, free association. The correct answer is option C, exposure therapy. Gradual exposure reduces fear response. Best therapy for phobia is exposure therapy. Which of the following is an extrapyramidal symptoms? Option A, dystonia. Option B, depression. Option C, tremors in Parkinsonism. Option D, panic attack. The correct answer is option A, acute dystonia is a extrapyramidal symptom. It means sustained muscle contractions. Which neurotransmitter is elevated in anxiety? Option A, serotonin. Option B, norepinephrine. Option C, GABA. Option C, acetylcholine. The correct answer is option B, norepinephrine. Overactivity of non-adrenaline system causes anxiety. Attributing one's feelings to others is option A, option B, projection, option C, repression, option D, regression. The correct answer is option B, projection. Projection means blaming others for own feelings. Attributing one's feelings to others called psychological dependence is characterized by option A, tolerance, option B, craving, option C, withdrawal, option D, seizures. The correct answer is option B, craving. Psychological dependence is characterized by craving, desire for repeated use for pleasure. Neologism means option A, repetition of words, option B, creating new words, option B, mimicking actions, option D, incoherent speech. The correct answer is option B, creating new words. Neologism means creating new words. Schizophrenic patients often coin new words. Which drug is teratogenic among mood stabilizers? Option A, lithium. Option B, valproate. Option C, carbamazepine. Option D, lamotrigine. The correct answer is option B, valproate, sodium valproate. Valproate causes neural tube defects. First stage of grief according to Kubler-Ross. Option A, denial. Option B, anger. Option C, bargaining. Option D, depression. The correct answer is option A. It is the initial response to loss. First stage of grief according to Kubler-Ross is denial. Priority in aggressive patient management. Option A, give medication. Option B, provide safety. Option C, offer counseling. Option D, allow ventilation. The correct answer is option D, provide safety. Safety of patient and staff is first. Priority in aggressive patient management. Provide safety. Best therapy for borderline personality disorder. Option A, CBT. Option B, dialectical behavior therapy. Option C, psychoanalysis. Option D, hypnotherapy. The correct answer is option B, DBT. Dialectical behavioral therapy is a special designed for borderline personality disorder. Repeat cycling in bipolar disorders means option A, 2 episodes per year. Option B, 4 or more episodes per year. Option C, weekly mood shifts. Option D, mood swings daily. The correct answer is option B, 4 or more episodes per year. Defined as more than 4 episodes of mania or depression in 1 year. Which is not part of nursing process? Option A, assessment. Option B, financial planning. Option C, planning. Option D, evaluation. The correct answer is option B, financial planning. Nursing process doesn't include financial management. Financial planning is not a part of nursing process. False perception of real external stimulus is option A, illusion. Option B, hallucination. Option C, delusion. Option D, obsession. Option A, illusion. Illusion means misinterpretation of real stimulus. False perception of real external stimulus is option A, illusion. Somnambulism means option A, sleep paralysis. Option B, night terrors. Option C, sleepwalking. Option D, insomnia. The correct answer is option C, sleepwalking. Somnambulism is walking in sleep. Somnambulism means option C, sleepwalking. Main purpose of therapeutic communication is option A, solve patient's problem. Option B, promote patient's self-expression. Option C, give advice. Option D, teach coping skills. The correct answer is option B, promote patient's self-expression. Encourages patient to express and explores feeling. Main purpose of therapeutic communication is to promote patient's self-expression. The primary goal of mental health nursing is to cure all psychiatric disorder, to promote optimal mental health, to prevent hospitalization, to control patient behavior. The answer is B, to promote optimal mental health. Mental health nursing focus on promoting mental health well-being and helping individual function optimally, not just curing illness. Then, which of the following is a therapeutic communication technique? Giving advice, active listening, changing the subject, offering personal opinions. Active listening builds trusting and understanding, which are called to therapeutic communication. The correct answer is B. Hallucinations are false belief, misinterpretation of real stimuli, sensor perceptions without external stimulus, excessive suspiciousness. The answer is C. Hallucinations involve perceiving things, voices, visions, that are not actually present. Which disorder commonly treated with lithium? Option A, depression. Option B, schizophrenia. Option C, bipolar disorder. Option D, anxiety disorder. And the answer is C, bipolar disorder. Lithium is a drug of choice for bipolar disorder, especially for controlling mania. Electroconvulsive therapy is mainly used in phobias. Option B, severe depression. C, generalized anxiety disorder. D, dementia. The correct answer is B. ECT highly effective in treatment resistant or severe depression. Electroconvulsive therapy is mainly used for the severe depression. The best nursing approach to a suicidal patient is leave them alone for the privacy, provide constant observation, encourage denial of feelings, avoid discussing suicidal thoughts. And the answer B, provide constant observation. Constant observation ensures patient safety and helps prevent suicidal attempts. Which of the following is an example of delusion? Option A, hearing voices. B, believing one is the president of country without evidence, seeing things that are not there, misinterpreting a shadow as a person. The answer is B. Delusion is nothing but false fixed belief not based in reality. The therapeutic nurse-patient relationship is based on social interaction. Option B, mutual respect and trust. Option C, financial dependency. Option D, emotional involvement. The answer is option B, mutual respect and trust. Trust and respect are key foundations for therapeutic relationship. Which is a negative symptom of schizophrenia? Option A, delusion. Option B, hallucination. Option C, apathy. Option D, agitation. The correct answer is apathy. Negative symptoms include apathy, social withdrawal, and flat affect. So these are the negative symptoms of schizophrenia. Defense mechanism where unwanted feelings are pushed into unconscious. Option A, projection. Option B, regression. Option C, repression. Option D, rationalization. The correct answer is C, repression. Repression is unconsciously blocking unacceptable thoughts. Which antipsychotic is considered atypical? Clopramazine, clozapine, haloperidol, fluphenazine. Clopramazine, clozapine, haloperidol, fluphenazine. And the correct answer is clozapine. Clozapine is a typical antipsychotic effective in resistant schizophrenia. Mental health is defined by WHO as a state of well-being in which an individual can avoid all stress, work productively and contribute to society, live without disease, remain happy always. The correct answer is B. WHO emphasizes functioning productively and contributing meaningfully to society. The first line of treatment for panic disorder is benzodiazepine, SSRI, selective serotonin reuptake inhibitors, antipsychotics, lithium. The correct answer is B. Selective serotonin reuptake inhibitors are preferred due to long-term efficacy and safety. A nurse uses silence during interactions with the patient. This is a non-therapeutic, therapeutic, avoidance withdrawal. The correct answer is option B, therapeutic. Silence allows the patient time to reflect and express feelings. Which neurotransmitter is mainly implicated in depression? Dopamine, serotonin, acetylcholine, GABA. The correct answer is B. Low serotonin levels are linked to depression. Which personality disorder is characterized by attention seeking and dramatic behavior? Option A schizoid, option B histrionic, option C avoidant, option D obsessive compulsive. The correct answer is B. Histrionic personality disorder shows excessive emotionality and attention seeking. In milieu therapy, the focus is on A. Physical exercise, B. Medication compliance, option C. Therapeutic environment, D. Psychoanalysis. The correct answer is option C. Milieu therapy creates a structured environment promoting healing. Wernicke's encephalopathy is caused by deficiency of option A. Vitamin B12, option B. Thiamine B1, option C. Niacin, option D. Folic acid. The correct answer is option B. Thiamine deficiency, commonly can see in alcoholics, leads to Wernicke's encephalopathy. A patient repeatedly washes hands to reduce anxiety. This is option A compulsion, option B obsession, option C phobia, option D delusion. The correct answer is option A compulsion. Compulsion are repetitive acts to relieve anxiety from obsession or thoughts. Which of the following is a mood stabilizer? Option A fluoxetine, option B valproate, option C diazepam, option D risperidone. The correct answer is B. Valproate is an anticonvulsant with mood stabilizing properties. Phobia is defined as option A sudden panic attack, option B irrational fear of specific object or situation, option C repeated unwanted thoughts, option D memory loss. The correct answer is B. Phobia are irrational fears leading to avoidance behavior or irrational fear of specific object or situation. Which therapy is best for phobias? Option A psychoanalysis, option B systematic desensitization, option C ECT, option D family therapy. The correct answer is B. Systemic desensitization gradually exposes patient to fear stimuli. So this is the best therapy for the phobic patient. Which of the following is not a therapeutic communication technique? Giving advice, option B clarification, option C restarting, option D reflection. The correct answer is A. Giving advice is not a therapeutic communication technique because it blocks patient self-exploration. Korsakoff psychosis is primarily characterized by option A memory impairment, option B hallucination, option C mania, option D catatonia. The correct answer is A. Korsakoff syndrome, alcohol related, causes severe memory loss. The nurse's first action when a patient becomes violent. Option A call for help, option B restrain immediately, option C give sedatives, option D leave patient alone. The correct answer is option A ensure safety and call for assistance is priority action. Most common side effect of antipsychotics. Option A extrapyramidal symptoms, option B hyperglycemia, option C hypertension, option D constipation. The answer is option A. Extrapyramidal symptoms like tremors, rigidity, and dystonia are common with typical antipsychotics. Which is a priority nursing diagnosis for a breast client? A. Ineffective coping, B. Risk for suicide, Option C, social isolation. Option D, low self-esteem. The correct answer is option B, risk for suicide. Suicide prevention is always priority. Token economy is based on option A, cognitive therapy. Option B, operant conditioning. Option C, classical conditioning. Option D, psychoanalysis. The correct answer is option B, operant conditioning. Token economy reinforces desirable behaviors with the rewards. Token economy is based on operant conditioning. The neurotransmitter implicated in schizophrenia is dopamine, GABA, serotonin, acetylcholine. The answer is dopamine. Excess dopamine activity is linked to schizophrenia. Agoraphobia means fear of open spaces or leaving home. Option B, closing faces. Option C, height. Option D, water. The correct answer is A, open spaces or leaving home. Agoraphobia involves fearing of being in places where escape may be difficult. Best response to a patient with hallucinations. Which is a mood disorder? Schizophrenia, depression, dementia, delirium. The correct answer is option B, depression. Depression is classified under mood affective disorder. Cognitive behavioral therapy is most effective for option A, OCD, option B, schizophrenia, option C, dementia, option D, alcoholism. The correct answer is A, OCD. CBT is highly effective in managing obsessions and compulsions. CBT is most effective for OCD. Flight of idea is a feature of option A, depression, option B, mania, option C, schizophrenia, option D, anxiety. The correct answer is option B. Rapidly shifting thoughts is a characteristic of mania. Flight of idea is a feature of mania. Antidote for benzodiazepine overdose. Option A, naloxone. Option B, flumazenil. Option C, atropine. Option D, protamine sulfate. The correct answer is option B, flumazenil. Flumazenil is a benzodiazepine antagonist. The nurse suspects neuroleptic malignant syndrome. Key sign is option A, hypotension. Option B, muscle rigidity with high fever. Option C, increased appetite. Option D, hallucination. The correct answer is option B, muscle rigidity with the high fever. Neuroleptic malignant syndrome is a life-threatening caused by antipsychotics. Then, case questionnaire is used for option A, schizophrenia. Option B, alcohol dependence. Option C, depression. Option D, dementia. The correct answer is option B, case questionnaire used for alcohol related problems. The first psychiatric hospital in India was established at A, Ranchi. Option B, Kolkata. Option C, Pune. Option D, Chennai. The correct answer is option D, Chennai. Chennai, Madras housed the first psychiatric hospital in 1794. Mental status examination doesn't include option A, appearance. Option B, thought content. Option C, insight. Option D, ECG findings. The correct answer is option D. Mental stress examination evaluate psychological, not physiological function. Mental stress examination doesn't include ECG findings. The phenomenon of believing television is sending personal messages. Option A, delusion of control. Option B, referential delusion. Option C, thought broadcasting. Option D, illusion. The correct answer is B, referential delusion. Referential delusion is nothing but belief that events or messages are directed at self. The drug of choice for attention deficit hyperactivity disorder is option A, haloperidol. Option D, lithium. The correct answer is option B. Methylphenidate is a stimulant effective in ADHD. Which of the following is not a symptom of PTSD, post-traumatic stress disorder? Option A, flashback. Option B, nightmares. Option C, intrusive thoughts. Option D, euphoria. The correct answer is option D. PTSD involves re-experiencing trauma, not euphoria. Obsessions are option A, repetitive actions. Option B, persistent unwanted thoughts. Option C, false belief. Option D, memory loss. The correct answer is option B, persistent unwanted thoughts. Obsessions means persistent intrusive thoughts. Therapeutic community concept was developed by option A, Maxwell Jones. Option B, Freud. Option C, Carl Rogers. Option D, Skinner. The correct answer is Maxwell Jones. Maxwell Jones developed therapeutic community model. Which neurotransmitter imbalance is seen in Alzheimer's disease? Option A, acetylcholine deficiency. Option B, dopamine excess. Option C, serotonin deficiency. Option D, GABA excess. The correct answer is option A, acetylcholine deficiency. Alzheimer's disease is associated with reduced acetylcholine. Mutism is common in catatonic schizophrenia, bipolar disorder, OCD, PTSD. The correct answer is option A. Mutism is common in catatonic schizophrenia. Catatonic schizophrenia often present mutism and posturing. The main priority in management of delirium is option A, psychoanalysis. Option B, reorientation and safety. Option C, long-term counseling. Option D, cognitive therapy. The correct answer is option B, reorientation and safety. Ensuring safety and orientation is critical in delirium. Which of the following is not a anxiolytic? Option A, diazepam. Option B, lorazepam. Option C, alprazolam. Option D, clozapine. The correct answer is option D. Clozapine is a antipsychotic, not a anxiolytic. Nurse notices patients mimics her actions. This is echopraxia, echolalia, neologism, perseveration. The correct answer is echopraxia. Echopraxia is nothing but imitation of another's movement. Most important quality of psychiatric nurse is sense of humor, emotional stability and empathy, high intelligence, strictness. The correct answer is option B, emotional stability and empathy. Emotional stability and empathy help nurses build trust and provide effective care. Thank you all.